Well, sometimes patients are feeling well and are having a routine upper endoscopy, and they're found to have a tumor. And when the endoscopist biopsy it, they're often very surprised that they even have a cancer because they feel so well. That's a small group. The vast majority of patients with esophageal cancer start to notice that food is getting stuck on its way through the esophagus and into the stomach, and then they have associated weight loss. In those patients, their symptoms is what brings them to the doctor, and that's how their esophageal cancer is found. Well, for most patients, they'll undergo an endoscopic ultrasound, which is like the original endoscopy that they had, except there's a special probe that can look to see how deep the esophageal cancer travels into the wall of the esophagus. This test is especially important for those patients who felt well and were surprised they had esophageal cancer. All patients will undergo a CT scan of the chest and the abdomen, and also a PET CT scan to see if the cancer cells have traveled either to lymph nodes nearby or to places outside of where the esophageal tumor is, such as the liver. At the time of the surgical consultation, we review all of the testing, and we're trying to determine those patients that can go directly to surgery without pretreatment compared to the patients with larger, bulkier tumors that are going to need the pretreatment. If a patient needs pretreatment, it's usually a combination of chemotherapy and radiation therapy, or sometimes just chemotherapy by itself before they go to surgery. Well, I tell patients that an operation for esophageal cancer is one of the biggest operations we do in all of surgery. And that is because we begin the operation in the upper abdomen where the esophagus meets the stomach, and then we prepare everything there so that we're below the tumor. And after we complete the abdominal portion of the operation, we then go in between the ribs on the right side into the chest cavity so that we can be above the esophageal cancer and get the tumor completely removed. And then the last step of the operation is to bring the remaining portion of the stomach up from the abdomen into the chest and connect it to the cut edge of the esophagus above, so the patient will be able to eat again. Because the vast majority of patients with esophageal cancer need pre-treatment before their esophageal cancer surgery, it's important that the medical oncologist and the radiation oncologist involved in their care are focused on taking care of patients with esophageal cancer. We are very fortunate here at Hopkins to have expertise in all the disciplines involved in patient care after their esophageal operation.